to Dr. Quinn to get us started.
And will my camera be on, Kip?
Oh, should be. Me. You should be able to start video.
Okay.
There we go. My apologies.
No problem. Thank you. I wish you all a great morning. First, I want to start by thanking Professor and Interim Director of the Kirwan Institute, Beverly Vandiver, for inviting me to present in the biweekly forum series today. I also want to thank Ashley and Kip for their assistance and logistical expertise in preparing me to present, as well as the Kirwan staff for the work they undertake daily. I also want to thank my Buckeye family and friends for taking time in this virtual space today, especially my colleagues and students from the College of Social Work. I also must express gratitude spiritually, as on this day 7 years ago, my family laid my grandmother, Jessie K. Mason, to rest. I do not take one moment, especially in this era of COVID-19, for granted. And in recognition of the over 500,000 souls who have transitioned, as well as those who have lost their lives due to state violence, let us have a brief moment of silence. Thank you for that. Finally, I want to recognize the Indigenous people right here in Columbus, Ohio, but throughout the state, who were here before Ohio was ever the Buckeye Nation we know and love today. I am honored to share with you what I believe is part of my life's work, centering the wellness, strengths, and health equity of Black and African-American girls and young women. So I will go ahead and share my screen so that I can share the slides that I've prepared. There will be points in my talk where I will check the chat because I would like some reactions to some of the content I'm going to share. The name of my talk is Do More, Do It Now, Community Engaged Research Addressing Health Equity and Crime Assistance for Justice Involved Girls and Young Women. I'm sure that we understand the link between criminality and American girls. I will define adultification as well as criminality. The second objective is to recognize the influence of both individual and family and peer support, which are protective factors that could support this population. And finally, I would like to identify healing as an effective method to address trauma-related delinquency. So I do have a key message so that if anyone has to leave, or as we've already experienced, there may be some technical difficulties, everyone knows this one key message. Black girls possess a resilience that points the way to how we can provide meaningful opportunities for their development. So this, just by recognizing this today, all of us can do something right now to help. I would like to give a little background just so you have some context on the population. These are the definitions I was speaking of: criminality, very self-explanatory. Adultification may be a new term to some of you. I refer to it in the manner of the Georgetown Law Report, where they talk about this perception of Black girls as less innocent and more adult-like than white girls of the same age, and believe that that could be some of the connection or a link to why girls, Black girls in particular, are growing in such fast numbers as far as system involvement, particularly with the juvenile justice system. We've heard probably a lot about protective as well as risk factors. This talk really focuses more on protective factors and their ability to modify or ameliorate the effects of risk. Health equity is this understanding around an underlying commitment to reduce and ultimately eliminate health disparities, particularly with racial and ethnic minority groups. Crime assistance also may not be as popular as terms as recidivism or reoffending, but it more so speaks to the individual in terms of this phenomena of giving up crime or moving away from crime. Justice involved is pretty straightforward. Healing or healing-centered engagement is an idea that was coined by Sean Jenwright, who was an African-American studies professor, and in his work with trauma-informed care, he moved to this place of thinking about healing as opposed to any other concept related to trauma. Recognize that trauma is important, but having had interactions with young people in the Northern California area, one young person said to him, "Hey, you know, I'm not my trauma." And that really forced him to think, yeah, he's right. And that there are other ways that we can kind of conceptualize what it means for individuals to deal with trauma, violence, or victimization, and thinking of it more collectively, and this idea of healing-centered engagement. And then finally is community-based participatory research, which in my eyes is the gold standard for research, where stakeholders and community members become active participants in multiple phases of the research process. So I just want to make sure that we're all kind of operating with similar definitions in what we're talking about. I do want to show a video. This gives more context around this idea of adultification of young Black girls, this notion of the erasure of Black girls' childhood and what that means. I could do a talk just on adultification as a whole, because it does hearken all the way back to slavery and on through Jim Crow, et cetera. So I'm gonna stop sharing and pull up this video that I think you will enjoy. It's a very short video, which is also a good thing.
Less protection, less support, less comfort. They know more about adult topics.
Let's see, we can hear it, but can't see you, I don't think.
And you can't hear it?
I can kind of hear it, but I can't see it.
Okay. I tested it earlier and it went fine.
I think you might have to.
Kip,
I can
can you
pull
pull up the link? Email? Okay.
Actually, yeah, I've got it up already. I can pull it up real quick.
Oh, great. Thank you. Great save. I'm gonna try it again. I think I may be able to do it.
Black girls need less nurturing, less protection, less
Can you hear that?
support, less comfort. They know more about adult topics, including sex. New research shows these beliefs are widely held in the United States. A groundbreaking report from Georgetown Law's Center on Poverty and Inequality finds that adults view Black girls as less innocent and more adult-like than their white peers. The study builds on previous research that found adults view Black boys as less innocent than white boys, starting at age 10. The new study is the first to focus on girls and finds significant adultification bias against Black girls as young as 5 and rising through age 14. The findings may help explain why Black girls face harsher treatment than white girls, both in school and in the juvenile justice system. Black girls are 5 times more likely to be suspended than white girls and are punished more for minor subjective offenses like dress code violations, disobedience, and disruptive behavior. Schools are more likely to call the police on Black girls. White girls account for half of all girls in school, but only a third of the girls referred to police and 30% of the girls arrested. Black girls are less than 16% of girls in school, but account for 28% of police referrals and 37% of arrests. Past research has shown prosecutors drop 7 out of 10 cases against white girls, while only dropping 3 out of 10 against Black girls. This data suggests bias plays a role when officials exercise discretion. Now, the new evidence that adults see Black girls as needing less comfort and less protection begs the question: how can we ensure that stereotypes of Black women as combative and hypersexualized don't reach into our schools and playgrounds and erase childhood for Black girls? Share your story. Girlhood Interrupted.
So what I'd like participants to do is go in the chat and just post a reaction.
Let's see if you you can access the Q&A instead, because that's what we're using kind of as a.
Okay, sure. Any reactions you can post in the Q&A will be great, and feel free. So TJ said that's horrible, heartbreaking, concerning. Absolutely. I would concur with all of those points. Someone else said shameful, but I am a witness to it. Absolutely. Not surprising, but still deeply troubling. The statistics don't surprise me, but they're disappointing. Not surprised. So many people are not surprised, which is also interesting. So I want to switch back to my presentation. And throughout, I'm going to try to check the chat because I like to have a little bit of interaction and see what people's thoughts are as I'm speaking. But I show that video because this idea of adultification is often not documented in empirical literature. It has started to be documented because of the work of the Georgetown Law Center, other individuals like Monique Morris, who wrote the book Push Out, the Criminalization of Black Girls in Schools, also has a documentary, which I saw the screening at this Congressional Black Caucus in 2019. Also very disturbing, very riveting. And I don't show it because I want people to feel angst. I show it for 2 reasons. One, I think it's important to recognize this term and what it means. How is it operationalized? And also, I often am asked, why do I focus my work on Black girls and young women? And because there are equally significant issues that impact young Black males, boys, and young men. And I agree, there are. However, I choose to focus on adolescents and young adults. That's my population. And within that population, I have decided that I want to center girls, Black girls, and young women, because at the benefit of focusing on young Black boys and young men through efforts like My Brother's Keeper, et cetera, there has been a bit of an overlook with regard to the circumstances that are impacting young Black girls and young women. And I would like the work that I do to serve as a vehicle to reduce those disparities. A little bit of background. Some of you won't be surprised to know that Black and African-American girls are the fastest growing group involved with the juvenile justice system. They're overrepresented in that system. And in addition, they often bear the burden of undiagnosed or misdiagnosed mental health problems such as trauma. Despite that though, when you look locally here in Franklin County, for girls who are engaging or have engaged, because this data is from 2018, in restorative justice circles, they were much more likely to successfully complete these programs if they were referred to those programs. So you see the yellow line is all youth and the gray bar are for Black girls. So 87% of Black girls successfully completed restorative justice circles. And one of the reasons I think this is useful to know is because restorative justice circles are healing centered activities. Restorative justice is another area of transformative activities that allow individuals to engage in discussions that are usually facilitated with the individuals that participate. Sometimes they use a talking stick. The only person that can speak is the person that's holding the stick. And these types of activities allow young people to talk about circumstances that are associated with their previous behavior or delinquent behavior. Were you trying to say something, Kip?
Yeah, sorry. You might have to reshare your presentation screen again because we're
sorry about that.
Oh no, you're fine. Just wanted to let you know earlier on. There we go.
Thanks for that. So again, my apologies. The first bar is all youth. The second bar that's gray are Black girls. And it shows how these restorative justice circles are quite effective in terms of girls being responsive to this type of activity. 87% of Black girls in 2018 actually successfully completed restorative justice circles. And these activities are going on in different places throughout the state of Ohio. In Lucas County, there are similar types of restorative justice circles, peace circles, they're called different things. And they are clearly having an impact. If you look at the second part of the table, the recidivism rates also have decreased as a result of participating in these restorative justice circles. So these types of activities that are more aligned with healing and transformative properties are showing significant impact that is positive and favorable for Black girls in particular. A little more background. Some of the reason that I, again, am focusing in this area is that I think there need to be an establishment of correlates of both health and mental health disparities that can lead us toward health equity for Black and African-American girls who are both understudied and underserved. These investigations are of salient protective factors particularly are critical to developing culturally tailored prevention and intervention strategies. I'm going to transition into a discussion about this particular publication that I co-authored with several colleagues. It has been published in the Journal of Criminal Justice and Behavior, and it is based on a randomized controlled trial of a sexual health intervention that took place in a detention center in Atlanta, Georgia. The study aim and hypothesis are listed here. We really, again, wanted to explore in hopes of establishing correlates of individual, peer, and family constructs and their relationship to post-traumatic stress disorder symptoms across a single sample of Black girls in Atlanta, Georgia. And all of these girls were detained or in a detention center. The first hypothesis that we included was that future orientation, self-esteem, and caregiver social supports would be associated with lower PTSD symptoms. The second hypothesis, that higher levels of negative peer norms and abuse history would correlate with greater PTSD symptoms. Just an overview of the method that we use, the sample and procedures. This is an indicated sample. So if you're thinking about public health language, they often talk about universal and indicated groups. Because these girls are all detained, this is an indicated sample of Black girls. They're all between the ages of 12 and 17. The total sample was 188. Again, this data is a secondary analysis from data that was a part of a larger study called IMARA. And that parent study, again, was with girls in detention in Atlanta. The questions that were used, they administered computer-assisted interview technology, what is called ACASI. And because this is a secondary analysis of exempt data, we didn't need to do any further IRB approval. These are the measures that we use. The dependent variable is post-traumatic stress disorder symptoms, which was based on the PSSSR, the PTSD symptom scale self-report. It was a modified version of it with 17 items. And it's important to note that even though this was a Cronbach Alpha 0.94, this was a self-report measure. So it's not a clinical diagnosis. Some of the questions that they were asked, whether or not they had bad dreams or nightmares about their trauma, or that did they relive their trauma, have any acting out or feeling as if it was happening again. There were several measures that have been used previously in different studies with my co-authors. History of abuse is one. It is a 3-point scale with higher scores indicating more abuse. This was a yes or no response category. And I listed a few of those questions and whether or not they have ever been either emotionally, physically, or sexually abused. Caregiver support also was a measure that has been previously used with these co-authors. This is a 10-item measure, and the response categories range from never to always, where higher scores indicated more caregiver support. It's important to note that because these items were negatively scored, we reverse scored them. One example of the items that were included were, I can count on my primary caregiver when I need to get something off my chest. Negative peer norms is a 17-item scale. Response categories were from 0 to 3, and they were all summed into a final scale, which ranged from 0 to 51, with higher scores indicating more support from deviant peers. An example of question that was asked, how many of your friends engage in the following behaviors: skipping school, stealing, using drugs or alcohol, and hitting people. Finally, the two have been identified, I identified as protective factors: future orientation, which is a 10-item scale. It is derived from Cooper-Smith's self-esteem inventory with response categories ranging from 1 to 4, very low to really high, and the range for higher future orientations from 6 to 40. Participants will respond to items such as, you will graduate from high school, you will be respected in your community. And finally, the self-esteem measure is a 10-item scale from the Rosenberg self-esteem scale. Response categories range from 1 to 4, 1 being strongly disagree, 4 being strongly agree, where higher scores indicated greater self-esteem. Examples of these items include, I feel good, I feel that I have a number of good qualities, and I feel that I am a failure. The analytical plan is pretty standard. We conducted univariate analysis with to describe all the study variables. We did bivariate correlation analysis looking at the dependent variable and their association, its association with the independent variables as well as age. And then we conducted multiple regression analysis with all the independent variables on the dependent variable of PTSD symptoms, controlling for the effects of age. The regression model was conducted with the total score of PTSD symptoms as the outcome variable. So when we talk about results, because of time, I'm focusing on the multivariate results, but if people are interested, this paper is published, you can find it online. The first finding that I was really was of interest to us was about caregiver support. So you see that it is a negative value, negative 0.17, and it is significant. And so this is pretty much saying that girls who reported lower levels of caregiver support reported also a decrease in PTSD. When we looked at negative peer norms, we see that it is positive and significant. So girls who reported positive higher levels of negative peer norms reported a slight increase in PTSD. So when we looked at the protective factors, self-esteem, future orientation, we noted that girls with higher levels of self-esteem, and in particularly future orientation, had lower levels of PTSD, which is what we had hoped for. So what does this mean? Well, with regard to future orientation and self-esteem, but not caregiver social support, which was associated with lower PTSD symptoms, our first hypothesis was partially supported by our findings. So this is a really interesting finding, and one that we grappled with. And one of the reasons that we think, we don't know, of course, that this could have been at least a caregiver finding is what I'm referring to. The result is because we're looking at a population of girls who are detained, so they don't have access to their parent or caregiver. It could also be that the parent or caregiver may also have a history of trauma, violence, and abuse that is not being measured in the study. There's no data about the parent's history of trauma or PTSD. So this could be eyeing toward what is considered intergenerational trauma, but we don't know, simply because this is not something we measure, but yet it's still an interesting finding. In terms of the higher levels of negative peer norms, but not abuse history, I didn't point that out specifically, but abuse history was moderate, but not significant. And so we wondered about that. And in essence, the second hypothesis was also partially supported by our findings. Since the abuse history variable, what we reported, we wondered, why is this the case? We know from other published research through Lou and others, colleagues, that there is a likelihood that adolescents, as well as African-American women, are less likely to report mental health problems, such as depression or post-traumatic stress disorder. It could also be that young people in this sample may make different meanings about the questions that are asked about abuse, or they simply respond to social desirability in ways that alter their responses. Now, one of the ways that bias was reduced was by using the software, the Akasi software. However, clearly this is a finding that we need to do more exploration. And lastly, we believe that our findings also reflect the need to examine structural issues like racism, poverty, violence, as well as other protective factors like racial identity and personal agency to unpack inequality, and further build support that could foster healing and growth with this population. Some limitations to consider: this is a secondary data set. It's not data we collected ourselves. We didn't decide on the measures, et cetera. We used what was accessible to us, which is not surprising with this population, as it is often very difficult to secure data about justice involved or even system involved adolescents and young adults. Again, I mentioned this, that PTSD was not a clinical measure as it was self-reported. Again, what could be the possible role of racism and discrimination or adverse childhood experiences, or ACEs? And this is with regard to the girls as well as their peers and or their parents and caregivers. Another limitation is that we examine direct relationships, but there could be interrelated and mediating pathways accounting for PTSD among this population, and we didn't explore that. So future research should consider intergenerational trauma. It should use critical or be informed by critical theories like critical race theory and intersectionality. And interventions should consider healing approaches to address trauma, stress, and PTSD, as well as utilize mixed methods approaches to elicit views, perceptions from the population that could better inform the quantitative findings that I've shared, some of which I've shared here today. So in conclusion, it is important to build and enhance parent, caregiver, family functioning that is associated with girls' responses of trauma, abuse, and PTSD. It's also important to bolster positive internal self-images and hope, given the protective effects of self-esteem and future orientation. I have a colleague who, Mark Courtney, is a nationally known, internationally known child welfare researcher, and he's been conducting a study in California where he's looked at youth who are involved in both the juvenile justice and child welfare systems. What he's found is that for adolescents who, pardon me, aspire to college or to attend college, they're a lot less likely to engage in behavior that would maintain their system involvement. He also noted that for young Black women who were parents, they also were less likely to engage in delinquent behaviors. So these are some aspects that, or constructs that serve as a protective mechanism for these individuals that could promote their future orientation. They see beyond the moment and what is happening. And similarly with young Black girls, we saw in the data from Franklin County Juvenile Court that girls who engaged in restorative justice practices were less likely to recidivate and were more likely to complete those programs. So any activities that are going to bolster their positive self-image and give them hope are needed. In addition, clinical services that address untreated trauma and promote healing and well-being can further moderate and reduce the effects of trauma and PTSD. And those are both needed in order to increase crime desistance. I just want to talk a little bit about community engaged research. I aspire to do community-based participatory research, and in the interim, I do community engaged work. And I say that because it is, as I alluded to a moment ago, it is very challenging and sometimes difficult to conduct research with these populations, whether it's secondary data or collecting data. It can be challenging, but part of the engagement process is rooted in my ability to partner with local entities who serve this population, as well as other collaborators who are also connected to these populations. As a pre-tenure faculty member, this is really important because this type of work, as I've said in my beginning remarks, it really is part of my life's work. So the balance or the juggle of conducting community engaged or participatory research is a long commitment, and it is an engaged process that takes a lot of time. So it does require a balancing act with both primary and secondary data so that your scholarship continues to be fresh and new. Some of the current other projects that I'm working on, it is a secondary analysis of data from corrections here in Ohio Department of Youth Services. It's looking at their screening instrument, data from the screening instrument, which actually took several years for me to get access to this data. I submitted an application to the Department of Youth Services in 2016, shortly after I got to OSU. It was approved 3 months later. The data use agreement took about 18 to 24 months. And I got the data maybe 4 or 5 months ago and have been kind of digging in it right now. And it's just another example of the process that is required. However, I do want to be clear that I know it's important to not have access to these adolescents' data or them, because they are a vulnerable population. And it would be remiss of me or any researcher to think that they could just have access. The main point I want to underscore, though, is that I value the experiences that these young people have had, and I'm committed to this type of work and want to see the benefit of utilizing this data in a way that is authentic and respectful to the individuals. The other project that I'm working on is data from young Black parents who live in New York City. There were individual semi-structured interviews that were conducted with parent dyads. They're all African-American court-involved Black parents. And we're currently analyzing those interviews and we'll be publishing a mixed methods paper based on those findings. The other project, I'm a co-investigator on a National Institute of Mental Health R01 mechanism, which is the largest program grant through the National Institute of Health. And the project is really looking at 9 public youth serving systems here in the state of Ohio to link them in order to identify periods of risk for suicide for young people. That includes Medicare, child welfare, juvenile justice, death records, et cetera. This collaboration is taking place with colleagues over in the College of Medicine, Department of Psychiatry, and we're currently working on a study to look at the role of mental health service use with regard to recidivism. Some other current and future work. I recently submitted an R21 proposal to the National Institute of Minority Health and Health Disparities. I'm the principal investigator. It is under review. This study is exploring PTSD symptoms, as well as barriers and facilitators to a mindfulness-based stress reduction intervention for justice-involved Black and African-American female adolescents and their parents and caregivers. This study, in many ways, was inspired by the one I just shared with you. Initially, my primary focus was on girls, but the findings in the study were such that I really felt that I needed to look at the parent-child dyad and thinking about them in ways to dig deeper with regard to intergenerational trauma, but also with regard to healing. The mindfulness-based stress reduction intervention is one that will be modified or adapted based on Gen Wright's healing-centered engagement. So I'm really excited about that. And maybe in a few months, I will be able to come back and tell you that my proposal was scored and hopefully could be funded. The other project that I'm working on and I'm actively collecting data for is a mixed method study. The previous one I just talked about is also a mixed methods, modified mixed method study. This one is a sequential design mixed method study, and it's really looking at both service providers as well as young adults' perspectives on structural and systemic barriers to avoiding trauma and crime. I'm writing a letter of intent for the Robert Wood Johnson Foundation Systems for Action Research Program and plan to submit that next month. All of these projects or the products from them are all an effort to continue the exploratory and developmental research that will allow me to culturally tailor interventions that will be effective for youth and young adults who are involved with, as well as those who are at risk of involvement with the juvenile justice system. Just would like to give some acknowledgements to the Omara study participants who were in the project that I presented today. All BIPOC, biracial, indigenous, people of color, girls and women, as well as scholars, advocates, practitioners, allies, students who are committed to this work. I also would like to thank my collaborators. Many of them provided me with letters of support for my NIH grant, Ohio Department of Youth Services, Franklin County Juvenile Court, and in particular, the lead judge, Honorable Judge Elizabeth Gill, Center for Healthy Families. The also important representative there is Dr. Patricia Lyons, who is a OSU alumni from our MSW program. And both of them actually are members of the Commission for Black Women and Girls, which is led by Councilwoman Priscilla Tyson. So they've been wonderful supports to me in my effort to move my work forward. Also, the Office of the Ohio Public Defender, who there is Nicole Klum, who has also been a great partner and collaborator. She and I have worked together on legislative issues such as the most recent bill that I provided proponent testimony for regarding mandatory parole reviews for juveniles who are on life without parole. They now will not have to wait, in essence, 40 years to get a review. It will be mandatory for a review to occur in 25 years. And the governor signed that bill last month, and it should go into effect in the next 60 days. And we're currently working on legislative action around the bindover, which is the issue of youth under the age of 18 who are automatically sent to prison, adult prison. So we're working on that now. We never sleep. And last is the Ohio Commission on Minority Health. My colleague and friend, Angela Dawson, is the director and has provided support as well as access to information and her network since I've been a faculty member here in Ohio. And of course, I could never go without acknowledging my collaborators here at The Ohio State University, College of Social Work, College of Medicine, College of Human Ecology and Education, and the College of Nursing. These are my references, some resources about Black girls, and we can never forget, because even when young women aren't involved in these systems, which is why I say are also at risk of involvement, they could be victims of state violence. And for those who may not remember, that is Breonna Taylor. So we can never forget. And with that, I will say thank you. And then we can move into questions and discussion.
All right. Thank you so much, Dr. Quinn. This is important information and an important conversation to be having right now. And thank you for dropping so much of this knowledge on us today. Thank you for participants who participated in the chat and the Q&A. We had some great participation, and now we're ready to move to Q&A. Just a reminder, if you have questions you want to ask, feel free to use that Q&A button to get to them. We'll stick to all the questions. We have some already in the queue, so we're off to a good start. The first one was, could you provide any examples of places or organizations that are doing this type of restorative justice work, particularly when it comes to, Black girls and Black women of color, that you might recommend people look further into, for examples?
That's a great question. There are aspects or types or maybe adaptations of restorative justice circles here in Columbus. One in particular that I'm aware of is associated with bereavement or grief and loss. And I know that it is happening with individuals who have been recently released from the Department of Youth Services. They hold a group that is co-facilitated by 2 individuals, and they have been processing most of the individuals' loss associated with friends of theirs who have died due to violence. There are likely others, and I'm happy to identify those and provide them either to you at Kirwan, or you can reach out to me directly based on, I'll put my email in the chat. I know it was on the slide, but I'll put it in the chat so that everyone would have it.
Sure. Yeah, we can definitely put those resources out when we send out the recording as well, too. So that would be fantastic. The next question was about resources. People, when you look at the variety of public and private resources for clinical services, especially in Central Ohio, are there some types of providers who are more or less likely to be able and willing to serve this population in ways that you would recommend?
Yes, I think that this is one of the major difficulties, or what might be considered a barrier. There are limited resources for whatever reason, particularly for Black girls. The likelihood of Black girls being referred for mental health services, unfortunately, is fairly low, and even lower than for boys. But I do know of practitioners who may work in private practice or other group practices, including those of color, who work with the population. So I admit it may be challenging to find out who these individuals are. And then there could be variations of services that may exist, because individuals have personal experiences and then they just start providing services in their communities or in their neighborhoods. So again, happy to provide some additional resources for that. There are the obvious settings like Nationwide Children's Hospital. They have multiple types of programming and activities. Harding Hospital also provides mental health services. But again, individuals do have to have a certain level of sophistication, and I would even say being really savvy to know what types of individuals they would want to work with. And I would even suggest that individuals reach out to the field office in the College of Social Work, because we have multiple partners, and I'm not trying to give our field staff additional work, but they are outstanding and they provide field experiences for all of our students from the bachelor's to the master's level. And so there are different entities that would in fact likely provide services for this population. And there are some very specific organizations like Kaleidoscope who provide services for LGBTQIA+ youth. The Black Women and Girls Commission is comprised primarily of leaders and executive directors of agencies in the city that provide services for this population. So say Center for New Directions is another place that individuals could consider. I mentioned one of my collaborators, Center for Healthy Families is another. They're a network of organizations that provide services. So they're out there, but there is a little legwork that has to be done to identify which ones may be the best fit for the individual who needs the services.
Thank you so much. This next question is about the data that it's been out there. And have you ever seen where the data has resulted in positive outcomes, like the creation of needed services, where, you know, this kind of data or these kind of studies have really been taken on by, you know, some sort of agency or community where they've really done something with it in a positive standpoint?
Absolutely. I mentioned the Commission on Black Women and Girls, and one of the things that they did was a study on their own. So similar to the Georgetown Law Center study, but this focus was more related to getting a general understanding around issues that are impacting Black girls. And they came up with, and it's a very comprehensive report. They have an executive summary as well. You can find them both online. And one of the recommendations that they had is for culturally tailored services for Black girls, which was really insightful as a next step. And so that also provided some synergy for me personally partnering with Franklin County Juvenile Court because of Honorable Judge Gill's work on the commission. And she and I discussed this at length and decided, well, this is an excellent vehicle for us both, because there is a need for this type of intervention development, but they also are interested in having services provided. So I would say dually, it happens that way. I think that when, pardon me, when entities decide that they want to provide services, sorry, I have a little tickle in my throat. When they decide that they want to provide services, part of what they do is look at data. And sometimes the data isn't enough. And so in my case, I wanted to talk to individuals directly. So the study I referenced that was submitted to NIH, I'm actually going to spend the first phase interviewing girls and their parents to understand what these barriers or facilitators could be, things that could influence the utility or what some public health people say is uptake of an intervention. Because there are interventions that are out there, but are they useful for the population is a question.
That's a really good point. I think, you know, utility is such a really good point when we're talking about like putting this kind of stuff into practice and how much that has to do with, you know, the situatedness of, you know, different populations, things like that. So a really good, really good point. We have,
Right.
We have a question about, do you work with school districts in implementing restorative justice programs with fidelity? This person said many contacts with the juvenile justice system begin with school referrals.
That's really an excellent question. I'm actually just starting. I have a colleague and sorority sister. I'm a member of Delta Sigma Theta sorority. And one of my sorority sisters is the chief diversity and equity I can't remember her exact title, but her name is Dr. Dion Blue. She also is a former Buckeye. She got her PhD here at OSU. And she's looking to do some work with Black girls and is planning to bring in national experts to talk about how they can better serve girls in their schools, because her role is for the entire Columbus City schools. And so the focus that she has around diversity, equity, and inclusion, I think is important. And so that is like the beginning of my kind of partnering and looking at schools. I've not really worked with schools directly in the past, because my population, oftentimes when youth have been involved in the juvenile justice system, they are no longer in mainstream school settings. Many times they are institutionalized or maybe in alternative schools. So the school kind of frontier is new for me, but I think it's an exciting space to look at what could be done in terms of prevention. So a great story I would share with you: when I was a doctoral student, I was a crisis worker. And this is when I was at the University of Illinois at Chicago, Jane Addams College of Social Work. And I was working part-time doing this crisis work. And what would happen is when children were identified as being at risk for either harming themselves or harming others, they would call our agency and dispatch one of us to the setting, to the location. So this particular day, the call was from a guidance counselor at a school. School's on the same side of town where I grew up, south side of Chicago. And so when I entered the school, I go into the office of the guidance counselor and I'm talking to them and I'm saying, tell me what happened. The counselor is really ranting, very upset. So it's clear to me there must be some type of relationship for her to be so angry. And so I asked, where is the young lady? And I'll just call her Pearl, the pseudonym for her name. And she pointed to the other room where she was. And so Pearl is about 15 years old. She's standing in the room and she's standing between two police officers who are both African-American females. So I walked up to Pearl and I said, and so all three of them, and I said, hello, my name is Camille. I'm here from X agency to talk with you. Do you mind if we walk over here and have a conversation? And she kind of shrugged her shoulders and followed me as we walked away to the other side of the room. So when I looked at her, I could see she was immediately distressed. She was starting to tense up. She was balling up her fists, biting her lip, and her eyes were filling up with tears. So I kind of leaned into her and I said, do you mind me asking where you slept last night? And when I said that, the tears just streamed down her face and she said, at a foster home. And I said, how long have you been there? And she said that she had been there 6 days. And I said, how long have you been at this school? And she said, a year. And so I asked her, did she know why I was there? And she said, yeah, but I'll let you tell me. I said, okay. I said, well, we get calls, and I just explained why I was there. And, she got alarmed part about harming herself or harming someone else. And she said, harm who? Her. Pointed toward the counselor's office. And I said, yes. And she said, Miss Camille, if I wanted to harm her, she would be harmed. And I said, okay. So have you ever thought about harming her? No. Have you thought about harming yourself? No. If you did, what would you do? I don't think about it. And I said, well, what happened today? And she said, listen, usually she's cool, we talk, and today she was quote unquote what she said, own one. So what that means when young people say or said at that time, because this was like 2012, so they probably don't say this anymore. But when she said that she was on one, that meant she was really in a bad mood and that she was abrasive, to be very plain. And I said, well, has she been like that with you before? No. I said she described their interactions, and what she described sounded like what would happen between two adults, two girlfriends, sharing a conversation, and then all of a sudden they are arguing. So it was very clear to me that she was confused about what was going on, and this is one of the examples of what adultification looks like in real life. Young girl like Pearl being treated as if she's an adult and picking up on social cues that she doesn't know about. And when the adult in the situation is dissatisfied or bothered by what they're doing or saying, then they respond very harshly. And this response led to calling the police and calling me. Now, depending on who else may have come, they may have decided to hospitalize her based on just the behavior that I described. The balling up her fists, tensing her body, biting her lip, appearing to be very angry. And so this is why this idea around the study finding that I had, history of abuse, may or may not resonate with the population because their responses may be very different based on cultural experiences that they've had. So in this particular case, I decided that I would not hospitalize her, that she was already suspended for 2 days so that she would be at home, and then our agency would do a follow-up visit with her. Now, the interesting part about this is the guidance counselor was angry with me because I decided not to hospitalize her. And I pretty much referred her to the principal, who I had already spoken with and informed them of my decision. And so I say that to say that this notion around how young people perform certain behaviors, particularly young girls, can be very complex to eyes or lenses that have no schema for their behavior. So even when individuals share the same categories of identity, they are both women, they are both African American, they may both live in that community, it does not mean that they are, in fact, going to be consistent with how they react with one another. So as adults, much of what we need to think about if we're going to do something and do something now is that we go back to what I said with the key message, which is to think about girls and young people, period, with this perspective around their resilience, because many of them are dealing with a lot of situations and circumstances that many of us never have. So being able to do that in a non-judgmental, solution-focused way, I think is a key to working well with this population in the future.
Wow. Yeah, I mean, when you were talking, I was just thinking about all the women in my life that I've heard that story from, in school or, in a place, and, all of a sudden you're approached by, it could be the police or somebody from mental health services about you causing your harm. And it was just a day for you. But because of those biases, it's like, this situation gets accelerated in that many times. I've heard that story so much. And yeah, that's what I was thinking of when you were talking. Definitely.
Right.
I know we're kind of getting a little on time, but I wanted to save time for 2 more questions, if that's okay with you, Dr. Quinn.
Sure.
One was really talking about the fact that we always hear about the necessity of mental health engagement to address trauma, especially within minority communities, but we seldom hear of empirical research surrounding the biases in action within that practice, particularly in the practice of social work in delivering those services. And this person was wanting to know Do you have any research, know of any research that's been conducted specifically on the adultification of Black adolescent women in mental health, youth mental health services?
Sadly, there's scant or little research that is focusing around the adultification piece as a whole. I do believe that there's a foraging of research that is focusing around the issue of bias. So for example, one of the partners that I listed in my acknowledgements is a part of the College of Education and Human Ecology. And we're actually looking at engaging in a project that would address biases and structural racism with a local children's serving system here in Ohio, looking at 2 different locations. And there's a mention that focuses around the issue of prejudice and bias. And it came about because a provider reached out to one of the investigators directly and stated that they've been experiencing microaggressions, racism, et cetera, from their superiors where they work. And so the idea around thinking about biases and what that looks like in organizations, I think is huge, because it's looking at the component that I'm really also interested in, which in the study I'm collecting data right now, which is looking at structural and systemic barriers. So when these types of biases are kind of baked into the cake, so to speak, so it may take some real work and effort, nuanced work and effort to really get at what those look like, because it's uncomfortable. It's uncomfortable to talk about individuals' biases or prejudices. We all have them. And the more that we can become aware of them, I think the better able and equipped we will be to address the issues that are associated with it. So yes, there's some work being done, less work around adultification per se. There is likely, I'm certain, the work hasn't been published yet, but I would gather, given the popularity of Push Out, Dr. Morris's book, that more work will be done in this area, because I do see the link, one, between adultification and criminality, but I also see this link between biases and adultification, which I think Georgetown Law Center, as well as others, have pointed this out very poignantly with their studies. So I would say, I would actually correct what I just said and say that the Georgetown Law Study is one of the best resources for empirical work related to the adultification of Black girls. Their study was comprised of focus groups with adults across the nation. And so their findings that said that most adults see Black girls as needing less nurturing, needing less support, perceiving them as adults. Again, there are individuals who have linked this to as far back as slavery, where children were not allowed to be children, they were not allowed to play, they were working as young as 3, 4, and 5 years old in the fields, picking cotton. So this idea of them not being children, the erasure of childhood for Black children didn't start in the 21st century. This is a historical connotation with a current modern day term.
Very good words, very good words. And I'm just gonna end it off with this question about collaboration. The question is specifically, have you collaborated with an organization called Help Me Grow Home Visiting, which focuses on parent-child attachment? But I'm also going to open that up to just kind of throw it to you and say, what sort of organizations or people would you like to collaborate with in this work in the future? So you can answer it either however you'd like to, but I
Sure. Great question. I don't collaborate with that organization, it sounds like an excellent potential collaborator. I don't shirk on opportunities to network and meet people. One person that comes to my mind right now is Jasper Person, who does a lot of community engaged work. He is what I would call a community whisperer. He knows many people, he's connected to many people, and he is engaged in work related to young Black adolescents. Jasper is currently building, if not already built, a residential school for Black boys who have pretty much been expelled from other local neighborhood schools. And he's planning to do the same thing, build a school for Black girls. And he's doing this right here in Ohio. So I would love more information about the organization you mentioned. If you could put the name of that organization, and if you know a contact person in the chat, that would be great. But I am right now, some of the individuals that I mentioned are some of my collaborators, and I also have colleagues that I consult with, work with, Fran Frazier with her organization for Black girls, Dr. Kevin Dixon, who just retired from the Adam Board, is also one of my close colleagues, and we talk a lot, and he's made a lot of connections with me here in Columbus, as well as individuals who have been connected to the state, like David Adeblute, who is a part of the Juvenile Justice Subcommittee that I sit on, and numerous individuals, judges and attorneys, et cetera, who are members of the Governor's Council on Juvenile Justice for the state of Ohio. So I don't shy away from individuals that I can connect to and network with. It's a great question.
Well, yeah, that sounds like a great way to kind of go forward. I saw a couple other people shared their information in the chat as well. So thank you for that. Thank you so much, Dr. Quinn, for your, just brilliance and your experience and your time. I know we ran a little bit over, so thank you extra for your time. Thanks to all the attendees for your questions and your input. This has been a great session. Just to let everybody know, a recording of this will be made available to registrants. So you'll get an email with this recording and information about our next forum in a couple of weeks. So be on the lookout for that. And I just, want to thank everyone again. We'll meet here again in 2 weeks, 11 o'clock for our next forum. And in the meantime, I hope everyone has a good day, a good rest of the week, especially you, Dr. Quinn. And we'd love to have you back again.
Excellent.
to
Would
talk
love
about
it.
your other person. Yes, definitely so.
And next time we will banish these technical issues.
Exactly. I've been using the word grace so much when it comes to giving and sharing and accepting grace. This has definitely been a time where everybody's gotten a chance to practice that. So thank you for giving grace for us for our technical difficulties today. And next time around we'll have learned something from this experience. So there you go.
Absolutely. Thank you so much. Thank you both, Kev. Thank you, Ashley. And again, many thanks to everyone at Kirwan and Professor Vandiver. And you all have a great rest of the day. Oh, when will the recording be available?
We usually make the recording available in the next couple of days.
Oh, great.
Everybody will get like that along in an email where have a recording and all the information. So if somebody has a problem, with getting the recording, of course, you can always reach out to me, Kip Holly. My email is in the registration. So feel free to reach back about that. And otherwise, we look forward to seeing everybody again soon.
Thanks so much.
Bye-bye.